Sure.
Name, spelling, title.
Sure. My name is Dr. Lawrence, Lawrence, Eisenstein, Eisenstein. I am the Nassau County Commissioner of Health.
It's a few weeks into this crisis. Where are we at?
I wouldn't call it a crisis. I would call it an opportunity to show what public health does. This is an important opportunity to show that this and any other communicable disease is part of what the public health community, our hospital partners and our medical partners are doing together to prevent the spread of disease. We know that we had a case that came to the United States. Disease was transmitted to a couple of the nurses working on the case, and we've learned so much from that. Our hospital providers here have done an amazing job, especially Nassau University Medical Center, which trained their staff, done public trainings through the county at the Homeland Security Center. We've trained first responders should they come across this situation, but we're all hopeful that this is an important training, that people learn what to do, but that we don't actually ever have to put it into use.
Good.
Take it away.
Hi, Dr. Victorpoliti, Politi. I'm the president and the CEO of Nassau University Medical Center, located in East Meadow, Long Island. We're a major level 1 trauma center here in Nassau County who receives a lot of the EMS ambulances. And actually we had a case of a person that traveled to the endemic area and presented with fever even before the Duncan case, even before the first patient, the index patient, came into Texas. And I realized at that time that the EMS providers, the police, the fire, and even my own staff in the emergency department really was not that well prepared to receive a patient that might have such a virulent organism such as Ebola. So we immediately began training our staff and equipping our staff with the hazardous materials equipment that required, the PPE they call it, the personal protective equipment, and stocking it in our emergency room and training. We also realized that the EMS and first responder personnel needed that training as well. And we began giving a series of classes, and we've given over 6 classes already of over 800 people. So we're training a lot of the first responders. It shows a great interest and a great concern on their part. We're trying to get across a message to them that this is, although a contagious and very dangerous disease, that it's not easily transmitted, and that you need to have close contact with personal body fluids, sweat, saliva, vomitus, and blood to actually catch this. And that although there's a risk, the risk is slow or low, especially when you're properly prepared and wearing the correct personal protective equipment. So we've been going through the training. We're preparing our staff. We're preparing the emergency room to receive any potential patients. And by the way, that patient that we had turned out to be okay. She had malaria and did not have Ebola, and we were able to treat that successfully, and she was subsequently discharged from the hospital.
Why are we here tonight, and where are we?
Well, tonight we're at Adelphi University, and Adelphi University has taken an initiative to get some of the leading providers and some of the leading experts in infectious disease in front of a panel, or part of a panel, in front of a large group of participants to talk about where we are with the Ebola cases that we've seen so far, what people can do to protect themselves, and what we're doing going forward to prevent this and other types of infectious diseases from causing outbreaks and mortality in the United States.
Nassau University Medical Center has come a long way in the last few years.
Yes, it has.
How prepared are you?
Well, I'll tell you, we've gone on to training for all the staff. We give 2 classes a day, one in the afternoon and one in the evening for the evening shifts, in which we view the department health video, and we actually try the suits on and don and doff the suits with our staff. The emergency department staff is trained. They have isolation rooms prepared. They have hazmat carts that contain the hazardous materials, personal protective equipment, including PAPR masks, personal air purified respirators, and other equipment that we have standing by. If in fact we do have a person that meets the criteria, we'll admit them to the hospital, we'll do the blood test, and if confirmed, we'll transfer the patient to a more appropriate facility that will be able to train to treat the person throughout the course of their illness.
Yeah, had just blown it out of proportion, or it was just the sort of normal fear that leads governors to quarantine nurses or forbid scientists to fly into the state of Louisiana for conferences. As if it weren't we, consumers of media, who were reading the newspapers with the grand project of public health. The Ebola panic in America is both evidence of the loss of faith and a reason to further mistrust our institutions. It also wiped America clean of smallpox and cholera, iodine deficiency, goiter and rickets, typhoid, pellagra. I could go on. is the project that's in danger. To takeover of public consciousness by Google, or if government has really let us down, that would take more time than I've got, although it would be fascinating. But clearly we in the health sector are part of the problem. With Ebola, public health leaders, what our officials have done for over a decade now is promote incessantly a rhetoric of preparedness, a preparedness crusade that has said to the public that America is in constant danger, and that only by taking exceptional measures at home, extra surveillance, no-fly lists, training exercises, and so forth, can we hope to be safe. That we Americans are actually healthier than ever after generations of public health improvements is impertinent, it seems. The constant state of emergency counts on eliding any distinctions between facts and fears. So it's reasonable to ask, given the state of emergency, why should Americans trust their health, our health, to our institutions? The Ebola panic, then, isn't really about Ebola. It's a panic about a crisis in the polity, a failure of the public to own up to what makes us healthy, a failure of public health agencies to win the public's confidence, a failure of officials, researchers, teachers, like me, to stand up and say that the world is not out of control, although it has its dangers.
Dr. Victorpoliti, Dr. Lawrence Eisenstein, and Dr. Barry Rosenthal. So I'll come and introduce each of those after he speaks. Welcome, Dr. Stan.
So thank you so much, Dr. Cohen. It's really a great pleasure to be here, and I really enjoyed the opening statement, actually. I think it was very thought-provoking, but in fact, as you're going to hear from what I'm going to talk about today, I really agree with a number of those messages, and most importantly, this concept that global health is America's health, and we do not have the ability nowadays to separate what's going on, whether it's West Africa, Asia, whatever part of the world it is. We can no longer make a separation and think that we're safe because of geography or anything else. What's happening in those countries does have a major impact on our country, and I think we have to have a health policy that reflects that.
That was excellent. Thank you so much. I'm going to give you guys a few minutes to pass your cards to the center aisle, and I'm going to introduce our panel. Zinab, come on up. Zinab Ataru, who's a nurse researcher and a doctoral student at Columbia University, and she's going to speak about the personal effects of Ebola in Sierra Leone. Dr. Donna Armelino, who's the Vice President for Infection Control at North Shore Long Island Jewish Health System, and who has set up the NASA Receiving Ebola Unit at Glen Cove Hospital. Dr. Reuven Pasternak, the CEO and Vice President for the Health Systems at Stony Brook University Hospital, which is Suffolk's designated Ebola hospital. Dr. Politi, who's the President and CEO of New Health, and thank you guys so much for coming. Dr. Larry Eisenstein, the Commissioner of the Nassau County Department of Health, and Dr. Barry Rosenthal, the Director of Winthrop University's Emergency Department here in Mineola. So they're going to speak a little about, from their own perspective about Ebola, and then we'll take questions from the audience. And if you have cards, you can bring them up.
Ms. Aturu, tell us a little bit about what's happening in Sierra Leone from your perspective and what some of the issues are.
Well, all right. Well, I'll share with you what my perspective is with the Ebola virus that has news all over. Well, after 10 years of civil war and conflict in Sierra Leone has lived to have a health profile that has working together and sharing food as a community. Unfortunately, the war has become the only experience that can compare that Sierra Leoneans today compare the world to Sierra Leone between 1991 and 2002. That's because for most Sierra Leoneans today, the war, or the impacts of the war, are the most similar, have the most strongest tragedy that has befallen Sierra